Hi guys, welcome to this short sharp video on the CSA exam, Clinical Skills Assessment, one of 3 components of the MRCGP qualification. It's all about how to take it, when to take it, how to prepare, what the best resources are, what are the best tactics to use when at work or when you're in your study groups, and pretty much everything you can think about when it comes to this big hurdle in GP training. I'm Aman Arora, I'm a GP and a medical educator. I've been through the CSA myself, I remember the whole process from start to finish, and hopefully this video is going to be of some value to you. Let's get started. So the CSA is a 13-station OSCE exam based at the Royal College building in London. It is designed to test lots of aspects of general practice, so not just your knowledge as a GP, but essentially how do you use all of that knowledge in the situation of a live consultation in different types of scenarios, clinical problems and setups. So looking at things like evidence-based practice, things like patient-centered care, shared management, how do you involve the patient throughout the whole consultation, how are your ethics, how is your professionalism, lots of different things can be tailored and tested in these 13 different stations. The exam lasts about 3 hours or so. You have, like I say, 13 cases, but you have 7 at the beginning and you have 6 after a middle break of about 15 minutes. Each case is 10 minutes long and you get about 2 minutes before each case before the patient and the examiner walks in the door. Throughout the exam, you're based in your own consulting room and role players come to you with their associated examiners. So you get examined with 13 different examiners throughout the 3-hour exam. You can take the CSA from ST3 level onwards and you get a maximum of 4 attempts, and the exam happens usually 8 or 9 times throughout the year, running from October through to around May time. Now, the various areas that they want to test can be tested through different means. So by far, most of your cases are going to be your standard face-to-face consultation in the room that you're sitting in to represent a GP surgery. But there are some variations. You can get telephone consultations where they're testing slightly different skills, perhaps with telephone triage or dealing with patients that you can't see results perhaps. Or there might be a home visit case where you're taken to another room completely and it's designed to look like a patient's bedroom or living room. They're testing certain skills there. Or you could get a third-party consultation, so either things like a patient relative or a patient carer comes to see you and other issues come in, things like confidentiality, or maybe a colleague comes to discuss a patient or a particular situation and they look and see how you deal with that scenario. So for the most part, most of your cases are going to be face-to-face, normal general practice, like in a morning or afternoon surgery, but you can get a few variations, so bear that in mind when you're preparing. Booking of the exam happens via the RCGP website, and for each particular exam slot, normally the booking opens about 4 to 5 weeks prior to that and tends to open for around 3 to 5 days. So you need to get in there and get your exam booked when you know which particular slot that you're looking for. Now, each of your CSA cases are marked in 2 different ways, numerically and subjectively. In terms of numerically, you get a maximum score of 9 marks per each case. So you times 9 by 13 gives you a maximum possible score in the exam of 117. When it comes to pass marks, if you look through the ranges, you normally get a pass mark of sort of low to high 70s. Now this varies depending on the day, the types of cases, the difficulty level, etc. In terms of your 9 possible marks, they're split into 3 groups of 3. So you're given a mark out of 3 for 3 things for each case that you do: data gathering, clinical management, and interpersonal skills. So data gathering essentially involves how you elicit data, how you utilize data, and how you can gather up information as a GP about a particular scenario so that you can use these things in the second half. So all about picking up issues of a case. And there'll be clinical issues, so you've got to do a decent focused history, you've got to be able to rule out things like red flags, you've got to be able to do a proper assessment from a history point of view, you've got to be looking at a decent examination, so how you pick up data through your examination skills, you may be given certain results, certain clinical letters, pathology, that sort of stuff, and it's about how you pick up all that data, how you put it all together so that you can pick up the key issues of a case and then move forward into management. And remember, data gathering is not just about gathering data clinically, you're also gathering data about the patient themselves. So their life, their psychosocial habits, their lifestyle, all these sort of things can influence the management, and it all comes part of data gathering. Clinical management is now all about how you manage that data. How do you manage the whole situation? Remember, you're not just managing a particular condition or clinical problem, you're managing the whole scenario and the whole situation. So that involves managing the whole thing. So yes, you've got to do a bit of clinical stuff in there and get that right, make sure it's evidence-based, make sure you're sharing things with the patient, making sure you're doing a proper, safe, appropriate management plan, using things like resources correctly, of course, but then you're also managing other things like managing risk, managing patients' psychosocial issues, managing their thoughts and ideas, and essentially putting everything together into a focused clinical plan that works for you and works for the patient, that's safe and effective. And then finally, get interpersonal skills. Interpersonal skills is not just how nice you are to the patient. Often it's thought of like that. Interpersonal skills starts from minute 0 and goes right through to minute 10. And it's a combination of many different things. How you bring the consultation together as a whole, how you involve the patient, are you sharing management with the patient, are you picking up on cues, are you reflecting emotion. This is where your ethics, your autonomy, all these professionalism will come in. So interpersonal skills is a sort of amalgamation of lots of different things. It's not just about how nice you are to the patient. So you're marked in 3 very specific individual ways. And if you want to get things like 8s and 9s in a case, you've got to be focusing on all 3. And one of the key things about that is making sure things like data gathering is focused so you have enough time for management. But also you don't want to leave data gathering too early without issues so your management is incomplete. And it's a balance about all 3. And interpersonal skills is about how you do all of that in a calm, consistent, professional way so you've got the patient in mind as well as your own needs. Now, in addition to your numerical score, you also get a global overall rating for your score. Now, this doesn't influence whether you pass or fail a case. It's more about how the pass mark is set up and how they find the pass mark for that day. So I wouldn't worry too much about it. It's called the borderline group method. But a lot of people I find get too hung up on the mark scheme, how they mark it, what they, trying to play the system almost. One thing I'd say is, look, if you do a decent data gathering, you manage things properly and you do your interpersonal skills correctly, you don't need to worry too much about the global score and how that all affects you. You need to go in there and do your stuff properly and you'll be fine. Just remember, there are 9 marks per case. Maximum you can get is 117. Pass marks around sort of early to late 70s, and you've got 3 different areas from where those 9 marks come from: data gathering, clinical management, and interpersonal. Focus on those things and you should be fine. Now, I get asked very commonly, when should you sit the CSA exam? I think there's no right or wrong, and you're going to know yourself when you feel ready. Now, there's a trend, I think, happening where people are taking CSA a lot earlier and earlier. So perhaps maybe the first sitting that you get in the year, if you're in ST3, people take it in October. And that can be okay, I suppose, if you've had a decent run of general practice in ST2. But there's 2 things I think that you need to have in place before you can think about being ready to take this exam. Number one, you've got to have a core understanding about what they're testing you on. So understanding those 3 domains: data gathering, clinical management, interpersonal. What are they looking for from me? What am I supposed to demonstrate, and how am I going to do that? Have a clear understanding about that. And secondly, you do need enough practice under your belt. You can't just prep for this exam by reading guidelines, reading through books. You need to have core practice, and core practice I think comes in 2 forms. One, practice at work, of course, but also practice in a study group as well. I think you need a bit of both. In terms of preparation time, normally I'd say on average from people that I see, it's about 3 to 4 months of proper practice. I remember myself, it took me about 3 or 4 months of getting to the stage where I felt confident, but I think you need at least that amount of time to seriously think about the CSA and to get ready for that big day itself. So how do you prepare? Now, like I said earlier, I think there's 2 main approaches in terms of practice for the CSA. Yes, you've got to do some background reading, get your red flags up to scratch, understand your key guidelines, yes, but in terms of practice, there's probably 2 main approaches that I see. You get the person who purely practices at work. It doesn't do any practice outside of that, but just see lots and lots and lots and lots of patients, which is great. Now, that's one thing that you can't teach. You can't teach what happens when you see lots of patients. You pick up a lot of small nuances about consultations. You pick up a lot of ideas subtly about what works, what doesn't. You get a lot of experience of symptom collection, forming diagnosis, thinking about how to manage these certain things. Of course, you pick up a huge amount from daily work life. So that's one type of practice. And then you see the other type of person who doesn't really think about CSA at work, just kind of is at work, but then purely practice from a study group point of view. So from that's good as well, because you need to have study group practice, because when you perhaps at work you might not see some of the more rarer types of scenarios that may come up in the CSA. So you may not see many domestic violence cases, you may not see a recurrent hypoglycemia too often, you may not see a drug user or someone requesting methadone quite forcefully too much in real life. So if you focus too much on real life, then you perhaps don't see those things. So study groups come in great where you're practicing those sort of scenarios that you don't see on a day-to-day basis. But if you purely practice down the study group line, then you won't pick up those nuances that you get from seeing lots of patients. So the first thing I would say is, look, you've got to do both, and you've got to think about CSA whilst doing both. So think about CSA while you're at work. Yes, I find it difficult to do CSA practice cases in all of my my patients at work. But I would pick up small areas, I'd perfect them throughout the clinic, and I'd make sure I'm working on certain things that I can take into the exam. But then you also got to get a really good study group set up and make sure you're practicing quite regularly and staying in that CSA frame of mind. Again, understanding what are those 3 areas, am I demonstrating those things, and am I asking the right sorts of questions and talking about the right sorts of things in management. So balance of 2 is really important. Now I've got another video talking about basic tips for the CSA, and also there's another video about how to maximize your study group practice. But a couple of good things about study group practice. Number one, normally it's all very nicey-nicey. I remember in my time, it's very nice, very relaxed. We often can't put people under pressure. We often feel very bad about saying negative things. So everything's quite, positive. Well done, that was amazing, that was great. But you perhaps get into bad habits and pick up routines. So you've got to push each other. You've got to, I think, be a little bit more firm in terms of when you're the patient. Really make sure that you're showing emotion, that you're reacting appropriately, because these things will come and hit you a bit harder if you're not prepared for them in the exam. And I think, yes, study group practice is really important, but self-critique is really important, I think, when it comes to preparation as well. So whether you've seen a whole lot of patients at work or whether you've just finished a study session with colleagues, on your way home, break down those cases. Think about, did I ask all the key things in data gathering? Did I get those red flags on, or did I presume them? Did I ask about that patient's psychosocial life? And if I did these things, did I bring these things back in the second half? If I asked ICE in the first half, did I bring these things back? Or did the patient have to remind me about these things? Did I pick up the cues that they were telling me about earlier, or did they pick them up too late? This is the kind of stuff that you need to be going through at the end of each sort of session that you do as practice, because it's only then that you pick up the things that you didn't quite do so well that you can work on, and that's when you start to find your confidence level boost as you improve throughout the time. So yes, practice at work, definitely, and think about CSA, but maybe don't think about the whole case, think about a particular area just to work on. Yes, practice in study groups, but make sure you push yourself, and thirdly, make sure you self-critique after your cases, because you need that internal thought and dialogue going on so that you can work out what you did well and be honest, so that you can perfect things and pick up as you go further. Another really common question with regards to preparing is, what book should I use? What's the best book out there? What's the best website to use for cases? And I tend to say 2 things. Number one, look, I haven't used all the resources, so I can't say which one is best, which one I wouldn't advise. But one thing I would say is that a case or a book or a website is only going to be as good as how the person role-playing as a patient portrays that particular case. So you could have the best book in the world, but if the cases are acted in a really robotic, no emotion type, sort of really easy giving the answers away type of way, then the book doesn't become so helpful. But you could get a book that's perceived, or a website or case that perceived as not so helpful, but actually if that case is acted really well, if you get some really difficult concepts in there, and if you discuss and reflect and you get the key points out, and your sort of second bit of self-reflection that I talked about earlier is really good, then actually it suddenly becomes a great book and a great website. So all I would say is, look, don't worry too much about which book is best. Just get a book, get some cases, start reading, start preparing, and start doing some self-critique, because you can make a book as good or bad as it is just by what you do and how you prepare. Okay, so the main day itself, obviously you're stressed, you're nervous on the day, that's completely understandable. Make sure you've got your right ID with you. Photographic ID is important. The MRCGP have a list on their website of equipment that you need to take. So it's usual things, stethoscope, other bits and bobs that you tend to have in the GP visiting bag, but make sure you've got that equipment list and make sure your batteries and things, you've got spare batteries. BNF, of course, is an important part. So have a look at that list, make sure you've got that well in advance, and borrow from the practice if you have to. When you get there, you're firstly given a quick debrief. It's sort of telling you about health and safety, that sort of stuff. And also there's a couple of reassuring lines said at that point. It's usually led by one of the more senior examiners at the college, but it's quite sometimes nice to hear some of those reassuring lines that they use, because you are stressed and tense. Of course you are at that point. You're then taken to your room, which will remain your room, as I said earlier, for the whole exam. What do you get in your room? You get various bits and bobs on your desk. So you get an iPad, obviously, which is going to have all of your cases, and they're all going to be in the order that you are going to see them. So you don't need to worry about which is first, which is second. You have a big digital timer on your clock, and remember that it self-sets each time the case starts, but it goes up from 0 to 10. So make sure when you're preparing, you prepare from 0 to 10. A lot of people prepare from 10 to 0, so it buzzes at the end, but then you get very used to that sort of setup. So you look at the clock and you're very used to where you should be at a certain point, and suddenly when it's all reversed and the clock's going up, It's just an additional thing to think about. So make sure you try and prepare in the same way that you're going to get on the day. On the desk, you might get some, you get a whiteboard firstly, so you can write what you like on this whiteboard. There's an eraser there, so you keep writing, erasing, writing. People put a few sort of bullet points there just to jog memory, and those kind of things can be quite useful, but you can use that whiteboard as you like. And there'll be a couple of things that just make it look like a GP survey, things like pathology forms, things like prescription pads. And you don't always have to use these things and write on these things, but they're there in case you want to. So you get a whole variety of things, and the idea is to make you feel like you're in a GP practice and you're doing a morning or afternoon surgery. Results of the exam tend to come around 10 to 15 days after the sitting. They're quite quick, given that the exams are roughly every month now, and your results come out by your e-portfolio. So you don't just get a pass or fail, you get a breakdown of your scores in the 3 areas, so data gathering, clinical management, interpersonal, which can be quite useful as well. And there's a grid that you get with sort of crosses and feedback, and it's worth looking at the RCGP website to see what that grid looks like and how it can be interpreted. So a bit about my own experience. I'm often asked about how did I find the CSA myself. Look, it was a blur, I'd say. That sort of three month period of the CSA, I remember it very well. It was it was all about CSA. The CSA just took over everything, I suppose. I decided to take the exam in November, so I started ST3 in August, took the exam in November, so I gave myself quite a short time in terms of trying to prepare for it, but that really got us into gear. We had about 5 of us who were in a group, and we got together right from the beginning. We planned it quite well. The one thing I didn't plan is that I planned to get married in October, so I had my wedding about a month for the CSA, and we decided to take the wedding out of the country. So looking back at it, it wasn't the right thing to do. It was a good sort of stressful week and a half at that point, but it worked out in the end. But apart from that, we really had a plan. I walked into it quite lazily actually, and I didn't really realise how much there is. And then when we started preparing, I thought, gosh, this is a lot. We've got to get through a lot of stuff here. So then we all knuckled down. We started practicing twice a week, went to 3 times, 4 times. By the end, for the last 2 or 3 weeks, we were doing, I don't know, 5, 6 times a week, and that was a solid practice. One thing we did really well is that when we got together, we did make it about practice. We maintained a certain level. We made sure we got through numbers of cases. We really pushed each other throughout that time. Sometimes when you're in study groups, you can be quite relaxed. Like I said, one thing we didn't do was that, and we really got us prepared for that mindset for the day itself. The day itself, I remember really clearly. I stayed the night, and it was a morning exam, so I stayed overnight in London, and I woke up. I was nervous as always, but I had done the walk to the exam centre the day before, so I knew the walk. It wasn't the first time I was walking that morning, and I'd seen the outside of the building. All that kind of stuff really helps. So I would encourage you to do that if you get a chance. On the day, like I said, you have your debrief. I was really stressed, but listening to those reassuring words was quite helpful. The first case I remember was a telephone case, and I was obviously nervous and anxious. I'm sure I made a few mistakes, but once you got into cases 2, 3, 4, to be honest, the nerves did go. I forgot that I was in the CSA, and I just started rattling out all the stuff that I'd been preparing for, and all the kind of, I got into the swing of it basically, and it seemed to go well. I had that break after 7 minutes. I stayed in the room. Actually, I went out, I think I had a quick glass of water and then came back in, but I think it's up to you what you do in that room. Some people ask me, should I go through all your cases at the beginning of the exam or in that break? I personally didn't go through any of my cases beforehand. I didn't want to confuse myself with going forward, but I think that's a personal thing. I remember about sort of case 10, 11, I started to think, nearly at the end, and I had to kind of snap myself back in and say, look, these are 9, 18, 27 marks here, so don't let tiredness, fatigue, or thinking about the end of the exam do yourself a disservice. So I kept myself buzzing till that end, but it can be quite easy to sort of tail off towards the end, so notice that, catch it, and that's why a lot of people do our mocks, because they want to feel what it's like to go through 13 cases. But I remember coming to the end, obviously I didn't feel as what's the word? I thought I was going to be really excited to finish the exam, but actually I was just exhausted. At the end there was no sort of big hooray, hurrah. There's no celebration. It's just, wow, I'm done. I'm going to go home. And I think I went and slept for quite a few hours. So that was my day. I remember it very, very well. I also remember the bit after that as well. As any exam, you go through days where you think, oh, I really did well, and the next day you think, oh, I said everything I said was complete rubbish, and you just don't know how you've done. But the business of ST3 took over, and that sort of got me through. And luckily, when we got the pass, again, it was quite anticlimax. It wasn't as big as I thought it would be, because out of hours I had that day, and real life still kicked in. But that was a difficult time. So my experience with the CSA was overall something that surprised me initially as to how difficult this is going to be and how much I have to do. We really got into the zone, cracked on with it, and made sure we made the most of our practice time. And then obviously the exam itself started off nervous, but then I got into the swing of it, and your sort of autopilot takes over, and you feel actually okay once you get through a few cases. usually. Depends on how those first few cases go. So how can we help you? A quick note about our stuff. The main thing is our main immersion 1-day course. It's jam-packed. We try and do as many role plays as possible. We're pretty much role playing from, sort of 8:30 in the morning up to about 7:30 sometimes. It's pretty full on, because I remember when I was preparing, what I wanted was role plays, but not just role plays, but role plays where they push you, challenging stuff, the stuff that you don't get sometimes in real life practice at your surgeries or in practice with your colleagues. So that's our main thing. We do full mock exams. Some people, like I said, want to get that full pressurized situation of 13 cases back to back, and how do you do? So we do that. We do one-to-one sessions. We have our revision posters. We have our CSA AKT support group. So we have quite a few thousand people on that now on Facebook. There should be a link down below. So have a look at that. We put a lot of free revision, free videos out for that. But there's lots of different things that we can help you with, and I hope to help you at some point in the future. So on a final end point, most people get through the CSA. You will get through the CSA. You just need to be pretty smart about how you prepare. And like I said, make sure those two things are in place. Make sure you understand what is being looked at. Make sure you know the 3 domains and what you have to demonstrate in that sort of situation. And then make sure you get your practice under your belt, both at work and also in a study group. Try and get both things running at the same time, and you'll be absolutely fine. Hope this video was of some value. If you have any other videos that you want making to do with the CSA, AKT, anything to do with GP training, just drop me a line. My details should be down below. If you are taking the exam in the next 2-3 months, I'm sure it'll be absolutely fine. Any queries you have, just drop me a line. Otherwise, hope to meet you at some point soon. Take care.